Hey everyone, so welcome to this special session. We have a group of residents, fellows, attendings, and we especially want to talk about the upcoming season, what will change from the students or the applicants' perspective, how should they prepare, and also what we think the programs will look for in the applicants this year. How will they assess the application? How will they look at from an interview perspective? So we have all these topics that we want to interact with our panel. And before we do that, let me just open it up for introduction. So probably we'll start with you, Rana.
Oh, hi everyone. I'm Reina, and I am an IMG, just like probably a lot of you. I came to the States to do my residency in IM from Mount Sinai, St. Luke's. I finished, and now I'm doing my fellowship in Canada. Uh, and I guess my aim is next year to build a practice, and that's where I am right now. I've been mentoring for the past 1 year, formally and informally, I guess, throughout my life. That's it about me.
Yep. Thank you. Thank you. So, Shailaja, let's go to you.
Sure. Hi, everyone. I'm Sailaja Pasipati. So just like Ryan, I'm an IMG too, but a slightly different career path. So after I graduated from med school in India, I actually did a urology residency in England and then moved across to the US for personal reasons. So I did have to go through a residency in internal medicine at University of Nevada, Reno, which I just finished this June a couple of months ago. And I am currently doing my GI fellowship at the Mayo Clinic in Arizona. So there you go. I've been mentoring with USMLE Sarthi for just over 3 years now. That was like a few months after I matched. I started this journey with Sarthi panel. The fact that we actually get to interact with a lot of IMGs and guide them to the process is something that I find very, very interesting and keeps me going. Thank you.
Thank you. Thank you, Shailaja. So, Chad.
Hi, everybody. My name is Chad Kogan. I currently am a PGY2 at Northwestern Memorial and a first-year anesthesia resident. Last year, I spent a year in internal medicine at Weiss Memorial Hospital, which is also in Chicago, where I was first really introduced to a large group of IMG students, and that really pushed me to get involved with USMLE Sarthi. So this is my first year formally helping out, and before that, on a more informal level, was able to help as well. I eventually have the goal of pursuing a pediatric anesthesia fellowship and then possibly a pain fellowship as well. And I'm very happy to be here.
Thank you. Thank you, Chad. Okay, so, in terms of the themes for today's webinar, we kind of divided into three. So the first theme is how programs will evaluate the applications in this season, given all the issues around coronavirus, the pandemic, inability to get probably the on-site rotations for many students, things like that. So let me go over to you, Raina, and what do you think when it comes to application review will be different this season from a program perspective?
Yeah, so I mean, I think if we take a step back, I think this pandemic has forced a lot of programs to align. Their goals have aligned. They've become very clinical. They want to make sure that that they're able to handle the patient volume. The residents are able to handle the patient volume in a responsible way. So in that way, traditionally, where university programs were looking for more research-oriented candidates and maybe even PhD candidates, I think this year they might be going for more clinically focused applicants.
I see.
Which are usually, I mean, the best way, or not the best way, but the traditional way of assessing that has been scores. Scores, I think, will still play an important part. I do think that some of the highest scoring candidates might actually have a chance in university programs. Community programs have traditionally always been very clinically focused. I think this year they'll also be looking for people who can integrate into the system existing system more quickly, or just where they don't have to train people to actually help integrate them into the system, because right now everyone's in survival mode. So they might be looking for people with a lot of experience in the US who have done not just clinical rotations, but maybe even have been residency in some other country where they're just very clinically focused and it won't take them too much time to integrate.
I see.
In terms of how they will look at that, I mean, one is obviously your background training. Second is, I think, references will count. So if someone, makes a phone call, or if someone says on your review or LOR that, this person was just ready for this, or they get the sense of that from the LOR, that will make a really big difference. Other things in the personal statement, when you write, or if a candidate writes a personal statement and makes it clear that they were just very ready to take on clinical responsibilities, just out of that student mindset into the clinical mindset, I think that'll give them an edge above other candidates. So these are just some clues. I think that programs will just be picking up on which candidates are adaptable, clinically focused, and responsible.
Okay, excellent. Yep. Shailaja, what is your perspective? And especially, I think I do want to understand a bit more on the clinical readiness piece, but also this trend of telerotations. So what is your thought on this telerotations and some of the other aspects?
I agree with Raina that there would be a lot of focus on people who have had a lot of clinical experience if they've managed to secure that before, particularly in the US, but not discounting other country residencies. With regards to telerotations, it's been a tough time for everyone. I mean, it's been a tough time for candidates, medical students in the US trained in the American system of training, for IMGs particularly, because you've not really had a chance to be exposed to the Western healthcare system here, because you've not been able to travel and all the programs have shut down the opportunity. So I think the telerotations, although not the best really modes of proving yourself and your ability, still kind of play a role, I think, in trying to demonstrate interest, in trying to know more about the system here. The professionalism aspect counts a lot. So if I had a choice between staying home and then maybe doing my own research versus doing a telerotation, then I would certainly want to get some hands-on that telerotation, even if it's a suboptimal experience when compared to the conventional traditional rotations. Now, how do you make use of these telerotations? Good question. So I think you will no longer have that, I'm going to be with an attending or with a few different attendings in a clinical environment surrounded by allied healthcare professionals, where they're going to assess me based on my communication skills, my interpersonal skills, or interaction with colleagues to demonstrate my team working ability. Yes, you won't have that advantage. However, you will have on a telerotation, you're interacting with your attendings in some telerotations. You will be interacting with patients in some telerotations, in addition to interacting with your attendings. And in almost all telerotations, you have interaction with peers. So there are also other colleagues that you're going to be interacting with, whether in the presence of a patient during that tele encounter, or whether it's beyond, after you've actually had an interaction with the patient. Maybe when you're talking to the attending, you'll probably have other peers on the call. So it really is down to, you have to demonstrate your communication skills kind of play a big role here. And while you are interacting with your attending, with your patients or peers, they'll still have the ability to assess your professionalism. So how you come across from a professional perspective, how you're able to communicate and interact with your patients as well as your peers counts a lot. You will have had some opportunities to also do some research on maybe an interesting case you have heard of or seen during that telerotation. So instead of saying, I'm done with my 3 hours of telerotation, there's not really a lot I'm gaining from this, why don't you say, well, I've had 3 hours of productivity today, of having the experience of maybe a direct patient encounter versus interacting with my attending. I've heard about a couple of interesting cases. So I'm going to use maybe a couple of hours of my own downtime to read about two aspects that I've learned from today, enhance my knowledge. And then tomorrow, when I'm back on that tele encounter with the attending, I'm going to bring up this discussion about what I have learned from yesterday's experience. That shows that you're being proactive. You're not just using this telerotation as a means of getting some USCE. You're also, obviously, you need to create a very good impression to get a strong LOR, even if it's a telerotation, because LORs, I think, are going to be very, very crucial this year for your applications. So your professionalism, your communication skills, your own proactiveness at trying to learn by yourself based on what you have already seen for a few hours that day, I think will count a lot. In addition to, do not discount the fact that you should not step over or elbow your peers who are also going to be part of your telerotation, because yes, you can be proactive and talk over, but do not make sure that you are not elbowing other people who are in the same position like you. You need to progress, you need to create an impression, but not at the cost of downplaying your own colleagues. That will be bad.
Okay. Thank you. Yes, so this is very helpful. So you, I think Raina mentioned about the clinical skills that will become more important, and you're talking about the self-training kind of the aspects, including the telerotation that will come into the fore. Chad, let me go to you and talk to us about possibly either the elevated importance of personal statement, if you think that'll be more important this season, or as in other seasons. What are other aspects that the programs will look for?
Sure. So I think that's a great question. And really quick, I wanted to harken back to something that Raina said very, very well. I think that in 2020, a lot of the applicants and a lot of the new medical residents have very much been tested. Of course, all of us go into medicine at some level because of altruism, because of the desire to serve and the desire to help. But I think in at least recent time, that has never been tested as much as it currently has. We all want to help, but of course, it's been a little bit at a risk of to ourselves and then to our families and loved ones. So I've noticed, especially last year when I was in a smaller community setting and we were very much burdened with a lot of COVID exposure and COVID patients, that it was a very polarizing experience. There was a lot of residents that were very, very eager to help, of course, with proper PPE and protection like that. And then there were a lot of other residents that kind of took a back role. And I found that the residents that were able to really step up and show initiative and really serve the community that they were there to serve stood out and made a fantastic impression on hospital administration, on program directors, and things like that. So I think going forward, and back to what you said, Bhuvan, in personal statements, if people could really stress, that they have realistic expectations of what they're getting into, and the difference in the current climate with what's going on with the global pandemic and how that will play into either further or manage their expectations and also further their desire to serve the communities that they will be placed in.
Okay. Good. This is very interesting. I mean, how do you demonstrate in the personal statement that whether it was COVID or any other initiative, how you gave back to the community? I think so. That is an important part. I think that you raised. Okay, Karuna, are you on? I see your audio is there.
Yeah. Can you all hear me?
Okay. Welcome, Karuna. So do you mind introducing yourself to the group?
Yeah, sure. I'm Karuna. I'm currently a critical care anesthesia fellow at Duke. I did completed my anesthesia residency, and now I'm doing 2 fellowships, critical care, and I'll be doing my cardiothoracic anesthesia at Duke next year as well. So as you can imagine, I've been very actively involved with working with COVID patients. I've been doing COVID ICU for the last 4 months, and now being a critical care fellow also, like I'm actively involved taking care of COVID patients. I am currently on maternity leave for 2 months, but also like I had to face the biggest challenge of being pregnant and working with COVID patients. So I kind of dialed in a little bit later, but I agree with all the sentiments that you guys have brought up. And I absolutely agree. You have to demonstrate in your personal statement sort of And also, I have been involved doing residency interviews for my program during residency, and I've been helping residents match into, cardiothoracic anesthesia is a little bit harder to match into these years, and I've been helping them. And this year, usually we have a spectacular match rate, but this year I saw like a huge difference in the match rate, where most of the programs, at least for fellowships, for residency it might be a little bit different, but uh, our fellowship results came out like in June and this October, and they're all almost like 90% of the fellowships went with their own residents. So because it was all Skype interviews, and they had to like switch from live interviews to Skype interviews in between, because you apply typically for cardiothoracic anesthesia in like November, but January is when the interviews roll out, and they don't start interviewing till like much later because the match results are like I think June or July. And so in between, all the programs had to switch. So next year they might not be as biased, but this year, because they had to go through that, most of our residents, like we only have like one cardiothoracic anesthesia spot in our program, so obviously we can't take all the residents who want to do cardiac anesthesia. But like other bigger programs who have like 6 or 7 spots, they predominantly went with all of their own residents instead of going with outside residents, because Skype interviews, also like my residents have kind of found it hard to adjust to the Skype interview. Some of them are very good at like in-person interviews with their body language and demonstrating their personality, which they were kind of apprehensive, and I guess they didn't perform as well in a Skype interview. So I guess that affected their match rate. And because usually like people who are scoring about the 70th percentile in our anesthesia ITEs shouldn't have a problem matching into cardiac anesthesia. But this year, like people who were scoring about 85th percentile, who had, I thought would 100% match, did not match. So I feel like everybody has to up their game and do something different this year. And in regards to COVID wise, the medical students that I have been rotating with, initially we were not letting medical students do their rotations, obviously, especially since also anesthesia is very high risk with intubations and aerosolization. So, but medical students were like actively involved with like telehealth, with helping at least internal medicine residents do their telephone encounters. With like coming to anesthesia rotation, we were all predominantly triaged to the ICUs, and we were doing ICU and ventilator management where we were not letting our medical students rotate. But here at Duke, they are back on the rotations and they're actively rotating with us. We still don't let them examine COVID patients, but people who are coming for their observerships and stuff, they're very actively, the students are very actively involved in helping us with consultations and telehealth and all of that. But they're not able to do their physical examination. We're not letting them examine the patients. We don't want to get exposed to COVID, obviously. So it's different. We're looking for different skills now, I would say, like the program directors or the attendings that you're working with. Because if you're not seeing the patient, you're obviously not taking history, you're not doing physical examination. But we're looking for a different skill set now, like how empathetic are you and how proactive you are in other things. Like if you're on your personal statement, if you can even include something like, I made homemade masks and I donated it to people, that's also like part of being involved with COVID. And some of our students were like volunteering at other COVID hotlines because they were not able to do their rotations, but that didn't mean that they took like a 2-month holiday where they were not doing the rotations and just sitting at home. But they volunteered to help out with COVID hotlines, because the general public, obviously being a medical student, you do still have like a little bit more of a medical knowledge compared to the general population, because people have been active, even drinking bleach to the extent there are like people who are, even though there's so much information on Google, people are still stupid. So there are medical students who are volunteering with hotlines and answering questions. So even if they can do something like that, whether in India or here, just to show that they had like an active participation to help in the pandemic, I guess that's what programs will be looking for. Because it's hard to like vouch for your clinical expertise when you don't have clinical experience, right? So you have to think out of the box and do something else, even though it may not be medically related. Like if you're making masks or if you're like helping out with other stuff, it's not like part of your medical training, but it's still something that you're doing to help out with the pandemic, and I think it'll have an impact.
Okay.
on your personal statement and stuff. So, and what the programs will be looking for, because this year is very different, what the program directors and what we will be looking for, I think. So it's kind of hard for everybody.
Yes. Thank you, Karuna. This was very, very insightful. And I think the other thing I picked up from what you said was programs are likely to go in for applicants whom they already know. Like you said, for fellowship, probably even for residency, if you've had a chance to rotate somewhere or they know you somehow, those applicants may just have an edge this year. Right?
For sure. Yeah. That's what's been happening.
Yeah.